Dentures are removable appliances which can help to improve appearance, speech, and the ability to chew food. However, dentures may increase the likelihood of tooth decay and damage to soft tissues. To minimise the damage caused from wearing dentures, it is essential that the denture fits as well as it possibly can. It is very important for denture wearers to continue to look after their remaining teeth. They could be utilised to keep the denture in place. When the patient first visits their dentist, a full medical and dental history is taken, and an examination will be carried out before it is decided that a denture is a possible option for the patient. A denture can be offered when the patient has a gap due to lost teeth. However, sometimes other options such as a bridge or implant may be considered. These options will be looked at in future videos. During the examination, we want to think about whether the patient already has dentures, how long they have had them for, and if there was anything in particular they liked or disliked about those dentures. This may help shape how we approach making the new dentures. So, the patient has decided they would like to have a denture made. How do we go about providing one? First of all, we need to take an impression of their teeth. The impressions will then be used to produce casts of the teeth. Once we have our casts, we use them to create a wax record block which will cover the area we are planning to have our denture sit over. The wax blocks are made on the cast and will be tried in the patient's mouth when they return for their second appointment. At the second appointment, depending on how many teeth the patient has and whether they bite together in an obvious and reproducible way, we may need to adjust our wax blocks we made so that they reflect how we want our dentures to meet each other when the patient is biting together. This is why we make these blocks in wax, because they are really easy to adjust. This means at this second appointment, we can take away or add wax to our blocks until we get them meeting just right before we send them away to produce the final denture. Next up, we plan how our denture is going to look. To help keep the denture steady in the mouth, we may decide to add clasps which will hook onto specific teeth. We may choose to modify certain teeth to allow for the placement of metal rest seats to provide extra support to the denture, or we may modify teeth in a way which enhances the placement of our clasps. At the third appointment, we will review and discuss the design we have created with our patient. We then carry out any of the modifications we have decided on, if there are any, and then we need to take new impressions in specially made impression trays which have been made to specifically fit the patient present. These new impressions will again be used to create casts of the teeth, but this time they will be even more accurate thanks to the use of patient-specific impression trays, instead of the stock trays we would have used for the first impressions we took. Lastly, the patient should choose the shade and shape of the teeth they wish to have on the new denture. You can use any remaining teeth the patient has to shade match the artificial teeth for a more natural look. We're almost there. Our next appointment will see us try in our dentures. At this try-in visit, we are checking the extensions. Does the denture cover the maximum area we want it to? The retention. Does the denture stay in? The adaptation. Is there a gap between the denture and the soft tissues? And the patient should have their say on how their denture looks. Our denture will still be in wax at this stage, but the artificial teeth we have chosen will be added, as well as any clasps or rest seats we chose to add. Sometimes the dentures contain a cobalt chrome framework, and the fit of this metal casting will need to be checked separately at a visit before the artificial teeth are added on. Finally, our denture can be processed in the laboratory so that our wax parts are converted into polymethyl methacrylate, or PMMA, a plastic material with a pink colouring through it to resemble the gums. As this material sets, the artificial teeth will set in place. The patient will once again visit and this time can try in the finished product. The dentist will check similar factors as mentioned for the previous visit. These include the extension, the retention, the adaptation, and the appearance of the denture. Small adjustments can still be made to the denture at this stage, and it may be necessary to remove some of the plastic material from areas where it may feel like it is digging in or slightly rough. Once the patient is happy with their new denture, you should give them some instructions for looking after the denture, including why they should take them out at night and explaining how to keep them clean. See the patient again in a couple of weeks' time to see how they're getting on with their new denture. Make sure you look in the mouth for any ulcers or signs of trauma that they didn't have at previous visits. You can adjust the denture as needed if the patient has discovered any issues since their last appointment. This has been a simple run-through of how to make dentures. Which topics would you like me to cover in future videos? Leave a comment below. Subscribe if you're new, and I'll see you in the next one.